Hello everyone. Today we are going to learn about the hypothyroidism, everything about hypothyroidism. In case of your exam point of view, the questions, what to write, how much to write in your exams. Okay, so let's start it. Hypothyroidism, clinical condition resulting from decreased circulating levels of T4 and T3. Now the etiology. Okay, thyroid, thyroid, thyroprivic. Okay. Now, the congenital development defect, primary idiopathic, post ablative radioiodine surgery, post radiation lymphoma, goitrous, heritable biosynthetic defects, maternally transmitted, that is, iodine, antithyroid agents, iodine deficiency, drug elicited, P aminocyclic acid, iodides, the phenylbutozones, iodoantipyrine, lithium, suprathyroid, pituitary, hypothalamus, self-limited, following withdrawal of suppressive thyroid therapy, subacute thyroiditis, and chronic thyroiditis with transient hypothyroidism, usually after a phase of thyrotoxicosis. Now, signs and symptoms. Onset, incidence with the physical, mental, and metabolic processes below the normal. Now, what are the general symptoms? Tiredness, somnolences, weight gain, cold intolerance, carpal tunnel syndrome, polyneuritis. Cerebral syndromes with the slurred speech, ataxia, muscle cramps and stillness, deafness of perceptive type, delayed relaxation or phase of ankle jerk reflex. Now, this is the diagrammatic presentation of the what what are the signs and symptoms of the thyroid hypothyroidism. Okay, so we will go one by one. The first is loss of eyebrow hairs. This is enlarged thyroid. Okay, next is slow heartbeat. Assimilation gets weak, so there will be poor appetite. Now, due to the hormonal imbalance, infertility, and heavy menstruation, the muscle cramping, the bone dislocation, bone discrampments may be there. So, carpal tunnel syndrome. Then, thinning hairs and hair loss. Puffy face means the face will be, very dry and, slightly swollen, dry and coarse skin, constipation, cool extremities, and swelling of the limbs. Now, see, the thyroid gland does not produce enough thyroid hormone, is the thing for this. So, what will happen? Weight gain, poor memory, intolerance to the cold, feeling of tiredness will be there. Yeah. Now, what will be the gastrointestinal symptoms? So, gastrointestinal symptoms will be constipation, ileitis, ascites. Okay, hematological means related to the blood or deficiencies of the blood. Now, anemia may be one of the following types: macrocytic hypochromic due to blood loss from menorrhagia, macrocytic due to associated B12 deficiencies, simple hypochromic macrocytic higher color index anemia on which thyroid has a specific effect. Now, reproductive system: infertility, menorrhagia, hyperprolactemia, and galactorrhea impotency. Okay. Now, miscellaneous means what are the different various other causes? It can be impairment of the smell, taste, and hearing may be present. Hoarse, husky voice due to thickening of vocal cords. Nails striated and tend to break. Hypotonia of muscles. Hyperlipidemia, exanthelasma. Now, hypothyroidism in children: deterioration in performance at school, lack of interest in games, arrest or slowing of the growth. Hypothyroidism in infants, that is cretinisms. Hyperbilirubinemia, bilirubinemia, failure to achieve the normal milestones, constipation, poor feeding, characteristic cry, typical constitution, that is coarse feces, thick lips, large tongue, broad flat nose, and the pot belly. Okay, yeah. Now comes the investigations. What will be the helpful investigations? Normochromic normocytic anemia, decreased serum concentration of total T4 and total T3, decreased T3 resin uptake, decreased free T4 index, increased serum concentration of TSH in primary hypothyroidism, decreased radioactive iodine in uptake, raised cholesterol, triglyceride levels. X-ray in children show bone age is delayed relative to the chronological age. Fragmentation of epiphysis at the head of the femur, ECG, sinus bradycardia, low voltage complex, and ST wave abnormality. So the treatment will be thyroxine replacement. Okay.